Hello. Today I will talk about what does self-care mean for individuals with diabetes. Welcome to Diabetes Free, the place where you get advice, motivation and inspiration for a happy and healthy life. Of course, diabetes free. When patients can't see a healthcare provider, they're left to their own devices, which often leads to self-care, a practice that many people take for granted. Self-care usually refers to indulgent relaxation, taking a hot bath, pouring a glass of wine or cutting an extra large slice of cake. Individuals diagnosed with diabetes have to be careful when partaking in those practices because they can cause more stress than they relieve. Medical self-care means a long-term commitment to avoiding health complications in the absence of a medical provider. This type of self-care can be overwhelming for patients experiencing diabetes, and it's unsurprising that most of these individuals struggle with motivation and support for self-care. Diabetes can contribute to long-term damage or failure of different organs, especially in the eyes, kidneys, heart, nerves and blood vessels, according to the American Diabetes Association. Therefore, self-care is necessary to limit potential organ damage, and it can reduce the likelihood of hospitalizations and emergency visits for patients. The following 7 self-care practices help patients with diabetes avoid hospital visits and serious health complications like healthy eating, being physically active, monitoring blood sugar levels, complying with medication, using problem-solving skills, developing healthy coping skills and practicing risk reduction behaviors. The above strategies have been positively correlated with blood sugar control, fewer complications and overall improved quality of life. However, there are several other recommendations that are often overlooked. Seeing an ophthalmologist regularly is part of maintaining good eye care and can help catch early signs of retinopathy, a condition characterized by blurred vision or partial blindness caused by damage to blood vessels in the eye. Check the skin and webs of the toes for any open lesions or sores, and make sure that nails are trimmed straight across. Wearing closed-toed shoes can help prevent foot injuries. Numbness can be a sign of nerve damage, called peripheral neuropathy, which is dangerous for older patients who lose feeling in their limbs and aren't able to test if bathwater is too hot or feel an open wound. Maintaining a healthy blood pressure and sugar level will deter symptoms associated with peripheral neuropathy, as will curbing fat intake. Early recognition can also help prevent some complications associated with resistant strains of bacterial infections that may lead to kidney complications. The earlier symptoms are reported, the better. Maintaining dental health, like brushing and flossing right after eating, can minimize the effects of gingivitis and periodontitis. If these diseases develop, they have the potential to contribute to blood glucose irregularity. Visiting a dentist twice a year can help catch early symptoms. Inspect skin for discoloration or dryness, which can make skin susceptible to scrapes and sores, especially when the body is dehydrated. Take note of uneven hair distribution or hair loss, which can result from hormonal changes, increased stress or nerve damage, and is sometimes a side effect of insulin injections. Drinking water and staying hydrated can keep skin strong and hair healthy. I encourage patients to talk about their routines with family members, caregivers or friends. It's hard to be motivated when you are alone. And as I always say, reversing your disease starts with knowledge and learning. To start your journey, click on the link in the description and download my free guide with 7 tips on how to reverse diabetes. If you want to watch more videos on how to reverse type 2 diabetes, make sure to subscribe to my channel. See you next time.